Hi everyone, I'm Dr. Angela Quang, and my Chinese name is Quang. I have more than 20 years of experience in internal medicine. I have been working at different hospitals in the Bay Area, and I recently just come back to the Bay Area and opened an office practice, internal medicine. The address is 1199 Bush Street, Suite 560 in San Francisco. The office is just across from the St. Francis Memorial Hospital. My office open Monday through Friday from 9 a.m. to 5 p.m. And I accepting on of the new patient with on of the insurance. Sleep is the natural cycle of the state of mind and body, characterized by alter of consciousness. Relatively inhibited the sensory activity and decrease the muscle activity, and inhibitions of nearly involuntary movement during sleep. So sleep, they divided to two phases, non-REM sleep and REM sleep. In phase one, non-REM sleep, they have three stages. Phase one, just at the beginning of the starting sleeping. Phase two and three is the deep sleep. REM sleep lasts longer, and most of the newborn, they spend most of the time in the REM sleep. Normally, the adults need about 7 to 9 hours of sleep every night in order to function well in the morning. And about 35% of the American population sleep less than 7 hours. And that can cause a severe health condition, consequences as like sleep apnea, diabetes, stroke, heart attack, or high blood pressure. So as we age, we will see change in our sleeping pattern. Like we can go to sleep early and wake up early. And also will have less deep sleep stage. And we also will decrease the melatonin. And melatonin is the body hormone that regulates our sleep pattern. There are common causes of insomnia for the adult: stress, anxiety or depression, stimulants. If you drink coffee, tea, or alcohol before going to sleep, that will disturb your sleep pattern. Other conditions like some medication, like steroid or diuretics, commonly called water pill, can cause sleep disturbance because when you take water pill, you tend to get up more frequent at night to urinate. And some chronic pain conditions like fibromyalgia. Most commonly for the elderly, they can get some other conditions such as like poor sleeping habit or environment. Lack exercise during daytime can cause like excessive sleepiness or not sleeping at all. The condition of stress like retirement, death of the loved one, or they have to move into a new living environment like nursing home or senior facility. Sometimes they lack of social engagement or feel lonely. Sometimes they have the sleep disorder such as sleep apnea or restless leg syndrome. And sometimes it lack of sunlight. Again, sunlight is that regulate the melatonin production. There are a lot of things that the individual senior can do to improve their sleep habits or sleep pattern. They can naturally boost the melatonin level by use just a small light bulb and really low wattage. So the room is not too bright. They can have the comfortable room, quiet, dark, and cool temperature so they can sleep comfortably. And elderly, they sometimes really sensitive to noise, so they can use the earplug, or sometimes they can even use the eye mask to cover their eyes. Some people, they like to take nap during daytime. And if they take nap, they should limit the time to 15 to 45 minutes, not too long. So it prevents you from not falling asleep at night. And when you take nap, should be early in the day, not too close to bedtime. And even take nap, you have to get a comfortable environment too. You can also keep a regular sleeping habit. If you go to sleep at 9 o'clock, 9 p.m. tonight, you shouldn't go to sleep like 1 a.m. the next night. Should keep around roughly the same time. Sometimes they can use a relax method and listen to the music with light, soft melody. The other stuff they can do that for diet, you shouldn't drink caffeine, alcohol, tea, coffee before going to sleep. You should eat less sugar, like carbohydrate, like white bread, rice, pasta, or French fry at night. And one important thing, don't eat a big meal and spicy food before you go to sleep because it can cause indigestion. And you should eat dinner at least like 3 hours before bedtime. For example, if you go to sleep at 10 p.m., try not to eat after 7 p.m. You can try some light snacks with low sugar, like low sugar cereal or yogurt or warm milk to satisfy your hunger, to prevent you like waking up during the night because you feel hungry. And drink less water before going to sleep. The next thing you can do is activity or exercise. You can do swimming or water exercise. You can do light walk or aerobic exercise. If you do aerobic, you can do either like 30 or 40 minutes a day, 4 days a week. Or some people, they try like 20 minutes 2 times a day. You can do golfing or Tai Chi, or you can walk with a slow pace. And if you're really in good shape, you can do running or do bicycle. You can do a checklist on what you should do the next day so that you don't have to think about that at night when you go to bed. If you have the list, you get it out of your mind. You should listen to music or read in the book during daytime, but not when you're in bed. You can do massage, or you can talk to a friend face to face. Now, for some people, if they lack of social engagement, they can volunteer, or they can join the senior group and do some activity on that. There is treatment such as like medication or cognitive behavior therapy. Now, for medication, I would not recommend to take the medication a long term because it's not a cure for insomnia. Some people, they use that when they go to the hospital and they have procedure or surgery. With the new environment in the hospital, they will need some medication to help them sleeping. If you need to use the medication, should not use that a long term because they have like different side effects. Like when you take medication too long, you will become dependent. The more you take that, the more medication you need. So if one day you don't take that and you couldn't sleep at all at night, but there is some medication that can help you. There are some benzodiazepine like Ativan or Xanax, Ambien, Melatonin. Some other supplement, you can get it over the counter, like melatonin is also over the counter, some magnesium, and some of the herbal. And one thing I remember they call that is the passion flower, and that can help to increase sleeping habit. Some antihistamine like Benadryl is also over the counter. Again, especially with benzodiazepine, we shouldn't take that in the long run. And the last one that is they call that the cognitive behavior therapy. So you talk to the psychotherapist about what's your negative thought in life, what is the behavior that prevents you from sleeping well at night, and any stress, so they can get your mind clear when you go to sleep. Now, the last thing I want to talk about is the sleep talking. That means that you sleeping, but you talking. But normally it lasts less than 30 seconds and it's harmless. About 5% of the adult, they have the sleep talking. A lot of study done, and they don't know why those people they have sleep talking. The theory is might be run in the family. They have some psychiatric disorder, illness, like anxiety, depression. They're taking some drugs, just like fatigue, fever, fibromyalgia. For sleep talking, they divide it by 3 stages. Mild stage is you sleep talk less than once a month. For moderate condition is once a week, but not every night. The more severe one is once every night, and it's affecting other people sleeping the same room with you. So when you have the severe condition of the sleep talking, you should see the doctor and talk to the doctor. But unfortunately, I don't think there is no treatment for that. So maybe when you see the doctor, you just go over, just try to rule out any chronic condition. If you're doing something like drinking alcohol, taking drugs, and that, if you eliminate all of that, that will help. The study, they say that adults need 7 to 9 hours of sleeping, but it depends on individual also. Some people, they sleep only 5 or 6 hours. It's enough for them, but that is not the majority. Now, as long as when you wake up in the early morning, you feel fresh, you feel you have energy, you're not tired, and you can go on with the daily activity, and that is fine. You don't have to get like 7 or 8 hours because you are different, your sleep pattern, maybe you need only 5 or 6 hours. But keep in mind, you sleep 5 hours, you wake up in the morning and you feel tired, no energy. You just falling asleep during daytime, and that is not good. You need more sleep hours. 3 a.m. that's the time that we should be in a more deep sleep. So 3 a.m. is not a normal time, unless some people, they working at night and they have been doing that for years and their body get used to that. But waking up at 3 a.m. at night is not a normal pattern. Well, it depends on the individual elderly. Some of them, they go to sleep at 9 or 10, but some others go to sleep later. So I would say if you sleep at night, you try to go sleep at the same time the next night and wake up maybe like 5, but not 3 o'clock. 3 o'clock is not normal at that time. So maybe if you try to go to sleep at the same time and your body will get used to with the pattern, you should feel fresh in the next day and not tired. For healthy adult, they can get like 8 or 9 hours of sleeping. So it really depends. But for the elderly, I would recommend probably go to sleep about like 10 or 11 and wake up like 5 or 6 a.m. No, sleep during daytime is not normal at all. So if the elderly sleeping daytime, I say it's not normal. Need to see the provider to find out why. Because sometimes they have trouble sleeping at night. Sometimes they have the sleep apnea. Sleep apnea, you breathing and then you stop and you wake up. And if they do it all the time at night, And of course, in the morning, they will falling asleep. They sleep the whole day. They sit down and they're falling asleep. Sometimes they fell out of bed or they fell out of the chair. So obviously it's not normal.